I'm so happy. I'm so happy to see this Congress. It's beautiful to see how the health sector, which is, I think, a key strategic sector for this city with a lot of new companies, but also leading institutions globally, are organizing this Congress. And today I want to share you why the health sector is also really interesting for us, for FC Barcelona, and especially for Barca Innovation Hub, the project that I've been leading for 7 years now. But let me start first with framing super short how is innovating at FC Barcelona and the challenges that we face. And basically, they are four, right? The first one is that our core business is super unpredictable. There's a lot of volatility, and that puts us in a situation where everyone in the organization, in the club, is basically thinking on 3 days from now, the next match, right? So that puts sometimes difficulties to think on a long-term basis. The second one is the fact that we, at our first team, face a zero-risk environment, right? Our players, which are celebrities, and the staff that works for them, their main asset is their trust. And if we fail there, the celebrities tend to say, I'm going to go with an agent that is bringing another solution that is better than the one that the club can offer. The third one, our beautiful brand. Everyone wants to be associated with our brand, and we face a lot of noise regarding to that, right? So a lot of people willing to work with Barca on an innovation perspective, but then it's just about how they can be associated with the brand and not create value, right? So we have to be aware of that. But not only that, our brand is also an asset. Super short chart to see that how the opportunity that we have behind us, right? So here you can compare the brand strength of different companies and the revenues that they are able to generate from those brands. We are quite far away from top brands, even though in terms of revenues, but we are at the highest level at the brand strength perspective. And last but not least, our governance structure, right? So we are a members-based club, 145,000 members who vote for the main decisions of the club, and that if you want to be fast and adapt to the changes that the world of technology and the world in health particularly that are coming, sometimes it's challenging to make those decisions, right? Just to give you a picture of how is the field of innovation at FC Barcelona. But let me also share a little bit on the purpose of the club, right? And it goes beyond just playing great football and winning matches. It's about creating a positive impact, right? And that's summarized under this claim, more than a club, that we are trying to put in place on a daily basis in every single department of the club, right? And that transforms into this purpose of the club, which is how we are able to create, to transform the world, to transform a better world through sports. And we think that sports is a key strategic discipline for doing that, because it intersects with many other sectors, right? We're talking about healthcare today, but we can think of entertainment, we can think of urban technology, right? So sports has this ability of create a huge brand awareness, a huge exposure, but at the same time intersection with many other industries. And that's what we're trying to bring here at Barca Innovation Hub, where is the project that leads all the innovation activities of the club. So what we do at Barca Innovation Hub, we try to empower everyone in the world that is trying to challenge themselves, trying to challenge the certain industry, and how we can help them through our brand, through capital, and also through connecting them to talent to create impact in this intersection between knowledge, innovation, and sports. And how we do that? With 4 pillars of activities. We invest in startups in our venture division. We also develop research projects or pilot technologies in our lab division. We have our congress to share different activities with thought leaders. And then we also have a talent vision, which is condensated in our education activities, right? Let me share you some success stories that we had in the past. We've been on the genetics world. I've seen a lot of different startups here on the genetics space, trying to help patients, help people to understand better their bodies. We did that on the high performance athletes demography, and we're starting to have some great results. We are also linked to different digital twins of our stadium, on that automating production for sports events. applying artificial intelligence to tactical analysis or to collective behavioral analysis. We're also working on the monitoring space for, in this case, for we call external load, the mechanical stress of our players with this performance tracker. And we are also into the regenerative therapy with some projects that we have at the fully funded by European Commission. Just to give you a short snapshot of things that we have been done in the past. But I want to talk about health, right? And why Barca is interested in health. The first thing is that we call it internally that our cancer are muscle and tendon injuries. We have a lot of muscle and tendon injuries, and our assets, our players, cannot perform because of that. We have a medium today of 15 muscle and tendon injuries per season per squad for football male squad. We have around 6 muscle and tendon injuries for our basketball teams, and we have around 14 muscle and tendon injuries for our rugby teams, right? But this is going to increase, and this is a study that was published several years ago from UEFA division. We are seeing that our players are getting more and more injured. And why? Well, because we play much more matches, and matches have much more demand in terms of mechanical stress, right? So that's something that is happening. 6 hamstring injuries by 2012, I guess, and we are getting into 12 hamstring injuries by 2030. This is a UEFA study, right? So what is the opportunity here? How sports and health has a great intersections? Basically in 4 pillars, right? Everything that has to do with prevention and wellness. Of course, on diagnose as well, rehabilitation, and return to play. Return to play is when we take a decision, when we make a decision of a player coming back to the pitch, right? But all these activities has to be linked to something that we have been talking in this morning is about personalization. How we are able to tailor all these 4 pillars of activities for all of our athletes, right? And that's something that we are already working with many different angles, right? But one of the projects that I want to give you a snapshot of a project that we are already working is about the Sportomics world, which is something that we are right now relaunching. We had a lot of projects. I already mentioned genomics, but we are also worked on transcriptomics, proteomics, and metabolomics to understand if this is something that makes sense for a demography of a high-performance athlete that sometimes is quite small, let's be honest, right? So we have 2,000 athletes in our club, but when we start segmenting by demography, segmented by age, then the samples start to get squeezed. But we had some great results, so we kind of bundled all these small projects, those exploratory projects, in those Sportomics projects that we are launching by now, right? So again, Barca and health are super linked. We want to invest in startups. We want to develop research projects. We want to pilot technologies. Please feel free to connect with us to explore potential opportunities. Thank you. 10 minutes.